Good evening, dear friends. Well, again in our homes, apartments, and huts, it's a holiday. Another episode of our weekly telethon, dedicated this time, as you love, to our brain, the blood supply of the brain, memory, to stay in clear memory at least until the age of 35. At least, and maybe some even want to be older. When they grow up, also to reflect well, to have a good memory, so that they have no problems with what your name is, what your wife's name is, what your husband's name is, your son, your dog, where the money is hidden, and others, as they say, do not bother you with problems related to memory. We will also talk about the crucifixion today. As you can see, a patient has specially prepared for us for the demonstration. But before that, let's have a little switch with you. I want to know how long you've been subscribed to our channel. How long you've been watching all the videos with pleasure, liking, commenting. Don't forget to hit the bell to watch new videos with pleasure. The freshest, not lagging behind everyone, because we've already watched the new ones. You're still watching there 3 years ago. You haven't watched the video yet. So, friends, write how long you've been subscribed, and we'll start in the meantime. Our brain, we know for sure that it is inside the skull. The skull is not just a bone, as you might guess, but it is made up of separate bones. In front of us is the frontal bone. Here are the temporal bones above covering our brain, and at the back here is where the occipital bone is located. On the side are the parietal bones. Here are the wings of the sphenoid bone. I will show you later. This is all our brain part of the skull. We also have a facial part of the skull, where the corresponding bones of the facial skull enter. The upper jaw, the lower jaw, the nasal bones, the cheekbones, the eye sockets form bones. Also the mesh. This is not particularly important to us now. The brain part of the skull with it would now be disassembled by us, so that you do not get confused. Forget everything that I just said, and listen again. Now the brain part of the skull. Look, between the ribs, you see, there are these little holes. These are the things they are called skull sutures. These sutures, they age as it was previously considered. The two bones completely fuse together. But as a result of recent studies which were conducted in the late 90s, it turned out that these bones maintain mobility even into old age. They move at any age. As long as they move, in general, remember, no matter how much there will be 36 multiplied by 6 when they stop moving, you already don't remember who your mom is. What kind of mom gave birth to you? Look, these sutures, they are located between all the bones. In childhood, these bones are not yet fully formed. They are more pronounced. But in adulthood, mobility in them is also preserved. The sutures are located here, the ones that will interest us today. Between the frontal and parietal bones, between the occipital bone and the parietal bone, between the occipital bone, here, you see, between the occipital bone with the pigtail and the mastoid bone. Why is the mobility of these sutures so important? The thing is, as osteopaths and manual therapists believe, in agreement with osteopaths, skull mobility impacts cerebrospinal fluid circulation, affecting brain function. But these are somewhat controversial issues, but it's better for the skull bones to move than not to move. And besides, it's indisputable what the skull bone can affect. Improper positions, asymmetry, it's a disruption of the cranial nerves function. Look at what we're doing. Ever seen anything like this? Ever? They only show stuff like this in the movies, see? They're showing it for free. It's like the Vikings sailed away from here. So, look, we temporarily prepare the muscles, we tear, we reach the head. Remove the eye? No? We'll leave it. This is the inside of our skull. On the outside, everything is smooth, but inside, you see, there's practically a maze. It's akin to a multi-level apartment for a small family. No, it's our skull structure. And these little holes, look. This is not a cavity a bug ate through. These are pre-designed hole structures, and either nerves or vessels, cranial nerves, pass through each of them. This is the largest technological hole. It is needed for the elongated brain, which then continues with our spinal cord. That is, this part of the brain, here is the elongated brain. The brain there, here at the back, is the medulla oblongata. It comes out from here and continues from here. So, I showed a little bit of cunning. She, in general, is also such a construction. The only thing, this hole, it should not be there anymore. This is just so that it holds. So, friends, with the incorrect positioning of the skull bones, there occurs a narrowing of these openings, which primarily, well, does not compress the artery, of course, but can compress a nerve, can compress a vein. Blood stagnation occurs. There is a disruption of the cranial nerve function. It all depends on which one was specifically compressed. There are even small holes for, see the optic nerve here. This is for those who have problems with their vision. Recall our discussion about the optic nerve. Here's the dry ring. When it gives way, it gets disrupted, causing atrophy of the optic nerve. If you didn't see the video, learn more about vision. Here, they didn't make such holes here, but here is the lattice bone. Here the olfactory nerves pass, right here to our nose. That's why when we breathe, we feel pleasant and unpleasant smells too. Here, friends, this is our sphenoid bone. These are the wings of the sphenoid bone. This is already the inner side of the occipital bone. Everything is not as smooth, you see, as on the outside. The outside is also not very smooth, and inside you can't figure it out at all. Here we have the frontal bone. Here are the ethmoidal air cells. They occur. Well, in short, this is the sphenoid bone, also a sinus. When it happens, it's a headache. If you're interested, I can shoot a video. Once after coronavirus, my nose couldn't breathe for half a year. Drops stopped helping. I can show you how many of these small dropper bottles I have. Nothing helped. I found a video on YouTube myself. Some guy made a way to get rid of a cold. Generally, for 6 months, I was mouth breathing all night and couldn't sleep. I did it once, and everything went away. If you're interested, write me. I'll also show you what I did. Even these drops, I'll capture all kinds of drops that exist. I'll capture for you. Just as alcoholics have bottles lined up, my nose drops are similarly arranged. I specifically saved them to make a video for you later. If you'd like, or if you're all breathing, I'm not sure. So, friends, conversations with you. But let's move on to practice, as they say. The sutures of the skull should be mobile. They should allow our bones to move to preserve the function of cranial nerves, drainage, flow, liquor, and full function of our brain, so that it gives us, like a video card, so that bitcoins can be mined on the main brain. So, look, let's start with this middle central suture. It's on your head, too. It's under the hair, under the skin, under the skull cap, right in the center. You put your hands on it, you don't feel any formation there. That is, it can't be distinguished from everything else. But your task is simply to find the center. Locate the center of your head. Many think that their lobe ends right here, where the hair stops growing, but in reality, the earlobe is quite large. You see? Here's the seam. Here's the seam right here. That is, it's located here. This is my forehead bone. It ends here. Imagine, yours is here too. And now our task is to work on this seam along the central line. First, just by pressing. You take your finger, you can take 2, you can hold it like this. If it's more comfortable for you to hold it like this, and you work it out. Just with such a pressing massaging motion, you make a forward-backward movement, left-right, circular movements. That is, you just need to massage this, your central seam, and here you will find diseased areas on it. That is, it will not all be diseased, but there will be certain more diseased areas. Stop at them, but there will also be areas without any sensitivity. Stop at them too. Pay attention to the diseased areas and areas that have lost sensitivity. Here is the first stitch that we are working through with you. The second stitch is right between the cheekbone and the temporal bones. Exactly the same way. This is how you work it through. Here you can identify it by the unevenness. Here, there is a certain bulge that you can trace along the entire seam. One bone, it is usually relative to the other, slightly uneven, slightly higher, slightly lower. And you will find this unevenness here. And you do the same along this seam. Also, this place is processed where, as you see, you have three bones joining at the same time. We've worked on it here, 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 here. All this has been worked on. Next is between the mastoid bone and the two temporal bones. Here we have only a part of the occipital bone. Now we will connect them, reconnect them, and close it up. You don't have this. This is an additional construction of insertion, an additional construction of the head movement mechanism. This is how you work the seam between the occipital bone and the temporal bones. And then I'll show you here, here, see? And then this part, this is the mastoid bone. This is the mastoid process of the mastoid bone, between it and the occipital bone. Very often it is this part of the seam that loses its mobility. Near this place, we have the sternocleidomastoid muscle and the trapezius muscle attached. It attaches here to the occiput. And here at this spot, when there's a spasm of these two muscles, or weakness, or when one muscle is spasmed and the other is weakened, that is, when there's a muscle imbalance, it causes a disruption in the movement of the occipital bone, and the compression of this suture. That is, it stops moving fully. Therefore, we also need to work it out well. And most of the disease points you will find right here. All this place right here on the side, it's covered by our masseter muscle. It belongs to the chewing muscles. This seam, unlike others, you will directly not feel and will not be able to work through. But there are also ways to increase the mobility of the temporal bone relative to the occipital bone, the temporal bone relative to the mastoid bone. But first, you need to sort out this very temporal muscle. To work it out, start right from this skull ridge of yours, and with your fingers, go through the entire muscle first.
It's quite large. It takes up all this space.
Go through it, find the sore spots, and work them out as well. For this, you can even use special massage tools. You can use a ball, a soft one is better for starters, or a roller. Here, you can treat it like this. Like this on a soft roller, like this you lie down, and also with its help you massage, work out the trapezius muscle. If you've never done this before, don't use a hard ball. Many people who have problems with hearing impairment, noise in the ears, hearing loss, after working out this muscle, the trapezius muscle, they feel as if they have started to hear new decibels. If, for example, you stopped hearing your favorite song after massaging this muscle, you will hear it again. Write in the comments how happy you are that you can hear your favorite anthem of your beloved homeland again. And they work this muscle from one side and the other. So this is our more simple primary action on the sutures themselves, on the bones of the skull. The next step is for us to learn to move these bones, to create movement. The thing is that each bone has a certain trajectory of movement. Each of them should move along a certain trajectory. If the position of the bone is disrupted, then the trajectory of the skull bone movement is disrupted. For example, the occipital bone, to simplify, it makes a movement back and forth. That is, there is a certain rhythm of the movement of the skull bones. It doesn't quite match the respiratory rhythm, it's more infrequent. The occipital bone makes such a movement backwards, as if it slowly deviates, a microscopic movement, and back. But it tends to turn or to one side or the other, like this, to twist. And therefore, the first thing that needs to be done to restore this mobility, this natural mobility that needs to be maintained, in some cases increased, we need to do exactly so that our own occipital bone is in a level position. It was located. Because the position of the occipital bone, it can even affect the tension throughout the rest of the body, and vice versa, for example. If one muscle is shortened on one side, weak on the other, then the occipital bone will turn. Well, about how the bones of the skull move, who is interested in this, who has already worked out all these seams, we will figure it out separately in a separate complex of exercises, as usual, guessed by the link in the description. Whoever wants to not only but also go there, we will figure all this out with you in more detail. Whoever is still working on removing all the disease points in the seams, stay here for now, then come over there to us. We will continue there with a more precise effect on our brain, restoring function. We'll meet there, God willing. Friends, until next time, until our next broadcasts, here we are with you. So help the parents, give likes, write comments. Bye.